With all the attempts to change our healthcare system on both sides, ranging from everything such as the latest Graham-Cassidy bill that would largely send the issue to the states, and Bernie Sanders' bill that would create a single-payer system, it is likely worth taking a look at how our current healthcare system operates. And right now, most people have what's called employer-provided or employer-sponsored healthcare. They get their healthcare through their employer. And while the ACA did create these exchanges and expanded Medicaid, it ultimately didn't change the fact that most of us get our healthcare through our employer, and in fact it expanded requirements for larger businesses to provide healthcare to their employees. So let's take a look at a few of the pros and cons of employer-provided healthcare. One of the biggest pros people cite is it's a way for healthcare to be run privately. Employer-provided healthcare makes healthcare available to a wide swath of the population without the government having to be directly involved in creating or administering this healthcare or health insurance coverage. For many people, especially those that are concerned about the size of government, this is a big benefit. And it's one of the few ways to provide wide-scale health coverage without the government being more heavily involved. Another big pro is that it lowers the cost of healthcare to the individual enormously. Employers usually pay a significant portion of the effective premium, and since it's group coverage, it also lowers the expenses for people who might have chronic conditions or other things that would cause their healthcare to be much more expensive than the average person. However, the problems with employer-based healthcare are also extremely significant. Employer-based healthcare is also subsidized by the government in the form of allowing health benefits to be tax-free. Neither the employee or the employer has to pay any taxes on the benefit of healthcare. This ends up costing our government an enormous amount of money relative to if it was paid out as cash and taxed normally. This also means that it's not entirely true that the government is not involved in paying for or providing this health care in any way. While they have no administrative role, they do provide a substantial financial subsidy. Employer-based healthcare systems leave out people who work at employers that are not required to and do not provide health insurance. If your healthcare system is based around most people getting their insurance from their employer and their employer does not provide it, it is much more expensive and much harder for them to acquire health insurance elsewhere. Additionally, those that do not have a job are also left out and left uninsured, and any of their dependents. Many of these people are unable to afford insurance elsewhere. Thankfully, in the United States, we do have a Medicaid program and a Medicare program that cover many people in this group, but especially in states that have not expanded Medicaid, there is still a large group that remains uninsured. Ultimately, the biggest con of employer-sponsored healthcare is that it ties people to a job. Many people that get a good healthcare plan from their job become much less likely and much less able to leave it, especially when they have families that depend on them and that also need to be covered. In addition to just trapping people into jobs that they don't enjoy, the biggest con of this is that it suppresses entrepreneurship enormously. If you're going out to start a small business on your own, you are often already taking a big risk and moving to a much more limited income for a while, and the fact that you now no longer have access to health care makes it even harder for people, even those who might be well positioned and well qualified and capable of starting successful businesses, to leave their current employment behind. When you don't have to worry about paying for health insurance and health care out of your own pocket, it is much easier to leave a stable job for a better opportunity that wouldn't offer health insurance. Another big problem with employer-based healthcare is that it puts a lot of the healthcare insurance decisions into the hand of the employer rather than the individual. People often criticize single-payer systems for doing that with government, where government decides the nature of what is covered and what's not. However, under our current system, it's largely these large employers that decide what healthcare plans they will acquire and what those plans will cover, and what things will have co-pays or deductibles, and what things won't be covered at all. This puts further power over our lives into the hands of our employers. Another pro of the employer-based healthcare system is that it encourages employers to implement health and wellness programs and to encourage their employees to be healthy. If an employer has healthier than average employees, it will end up saving costs on its healthcare expenditure. And if it takes that into mind and specifically creates programs designed to improve the health and wellness of its employees, it will end up both improving its employees' lives and saving money. Ultimately, while employer-based health insurance does cover many people and provide them with access to affordable health coverage, it comes up short in a lot of areas that make it inferior to many other health insurance programs we see in countries around the world. And its effects on entrepreneurship and the way it ties us to our employers are particularly disturbing. Let us know what you think about the pros and cons of employer-based healthcare in the comments below, and like and subscribe to learn more.